I'm super confident in the BEAR implant in my knee. I think it feels stronger than even before, which is awesome.
My name is Dr. Tim Crall. I'm an orthopedic surgeon and sports medicine specialist in Mammoth Lakes, California. Josh was a good candidate for the BEAR implant mainly because of his tear pattern. His ACL had peeled off of his femur, right up at the top of the ACL, and that's the pattern that we typically look for as tears that are really good candidates for repair.
I'm Josh Bowman. I'm from Mammoth Lakes, California, and I'm a professional half-pipe snowboarder.
All right, Josh Bowman, Mammoth Lakes, California.
Okay, here we go.
Into the giant front dump 10. Hit Mario Kart booster pad right there before taking off.
I don't know the exact moment I tore my ACL. I never heard it pop or anything. I just remember it was hurting over the whole season, and I think there were some times where I tweaked it a little bit. It was kind of bothering me. So I was like, I think I need to get it checked out at the end of the season. I knew I was gonna get surgery. I was kind of looking at the options. I remember reading this article about the BEAR implant and this new technology. I didn't know if it was available or not. And then I talked to Dr. Crall about it, and he was like, I think you might be able to do it once we go in and see. So I was like, okay, I'd love to get it instead of getting a tendon taken out, because I'd way rather have my original ACL in there.
The BEAR implant works by creating a clot around the healing ACL and acts as a bridge to allow it to heal from the tibia to the femur and using the body's natural healing response. In traditional ACL surgery, the old ligament, the old ACL, has to be completely removed. Then a graft of some kind, either taken from the patient's own knee or from a cadaver, is used to basically replace the original ACL. The two main benefits I see for the BEAR implant are, one being there's a faster return of function as compared to ACL reconstruction, and that's been shown in the literature. And the second is the preservation of the original ACL fibers, including those proprioceptive fibers. And we think that that's what gives patients that more normal feeling to their knee and a more normal knee function when they go back to sport ultimately. The BEAR implant should be considered for use in professional athletes. It does involve a little bit more of a discussion with patients when they come in, just to make sure they understand that this is a new procedure. These are the potential benefits, mainly more normal feeling knee function. It's bittersweet when athletes like Josh recover, because of course we don't need to see them again for a little while, and we hope that we never have to see them again unless it's out on the hill or out competing.
The journey of getting surgery is never fun. This is my third surgery. And I think that's the hardest part, is staying motivated in it. You're like, pain, or it's not getting better, it's taking a while. You're gonna get better. You're gonna be at the finish line eventually, and you're gonna be like, oh, I can go do everything again. And that's the best feeling, is when you get cleared, you're like, oh, freedom, I could go. I'm super confident in the BEAR implant in my knee. I think it feels stronger than even before, which is awesome. I was able to return to snowboarding and competition just 9 months after getting the BEAR implant. I'm very thankful for the BEAR implant and how it's paved the way for these new ACL surgeries, and how it's repaired my ACL back to its original form and how it's supposed to function. And I'm excited to be back snowboarding and competing.